you guys probably seen these bags on site recently. These are your Ambu bags. What comes in there is you're going to have a pediatric face shield. You're going to have a reservoir bag, the Ambu bag itself. You'll have an adult size or adolescent. You'll have some instructions, and then also tubing if you would need that, like when the fire department came. So when you have your Ambu bags and you take it out, make sure that you do extend it and open it up all the way. It should pop open like this. You will then go ahead and attach your reservoir bag to that. Oops, wrong end. And then you have to find out which face shield you're going to have to use for your patient. My patient is older than 12 years old, so I would go ahead and use the bigger one. When using this, you want to make sure that you create a seal over your patient's nose and mouth. It has to be a full seal. So I just want to make sure that it is going to fit and there is going to be a seal there. If I were using this alone for just rescue breaths, if my patient was breathing on their own or had agonal breaths, then I would use this for a child. I would give one breath every 3 seconds, and we want to give that breath over 1 second. If I were going to use it for an adult, it would be one breath every 5 seconds, and I want to squeeze it over 1 second. So it's easier if you have a partner doing your chest compressions. If you were doing chest compressions and using your rescue breaths, you would make sure that you do it after the 30 compressions, and then you would give 2 rescue breaths, whether it was a child or an adult. So first you want to make sure that you open your patient's airway. So you're going to have to tilt their head, and you're going to make sure that the mask seals over the patient's face, and you're going to use a CE method to do that. So you hold your hand like this with the C, and you're going to put it over the bottom of the valve, and with these 3 fingers you're going to go ahead and hold down here. Now you should see a chest rise and fall when you push on here. This is the trainer one, so we're not going to see any of that. So then after the 30 compressions, then you would go ahead and do the 1, 2. And you want to make sure that for your adults, you're going to go about halfway, you're going to squeeze it, and then for your children, just a little bit shorter than that. And that's how you use an Ambu bag.